Good evening, everyone, and welcome to our vaccine information session. This information session was actually because of multiple questions being asked by our parents and our students, and all the partners have come together this evening to make sure that we can answer your questions, set your mind at ease where possible, and go through some of the newest updates for you. Before I introduce everyone, we will start with our land acknowledgement. I would like to acknowledge that we are situated on the traditional, ancestral, and unceded lands of many indigenous nations, on which we are learning, working, and organizing today. The area known as Toronto has been taken care of by the Anishinaabe Nation, the Haudenosaunee, the Huron-Wendat, and the Métis. Today, this meeting place is still the home to many indigenous peoples from across Turtle Island, and I'm grateful to have the opportunity to work on this land as a settler. Some housekeeping items before we start. First, let's acknowledge our very gracious partners: Humber River Black Creek Cluster and Vaccine Engagement Team, Black Creek Community Health Center, Toronto Public Health, Toronto District School Board, Toronto Catholic District School Board. We want to also let you know some guiding principles. We hope to ensure that there is enough time in this session to address as many questions as we can, and to provide resources at the end of the webinar so you can follow up to get even more information, dates, locations for local vaccine and testing clinics, and more. When you go to ask questions, please ask questions in an intentional and concise manner. We will have team members reviewing the questions to include during our Q&A session. Our Q&A will be handled using your chat function. Now, we've been in COVID for a while and we've been in Zooms for a while, so you should be able to find the Q&A section. But if you can't, look to the top of your screen, and we will be using that function to field your questions throughout. Now, hold off on questions because you may hear the answers during the presentations. Also, we want to advise you that the recording of this session will be posted on Black Creek CHC's YouTube for your viewing. Now for the format of the evening. We're taking a webinar format. First, you will hear from our school board trustees. Then you will hear our keynote presentation from Dr. Vinita Dubey. And then we will have a full-on Q&A session. I'm going to start us off with some introductions. First up, we have our community ambassadors. These are representatives to you and for you to this panel. Starting us off, we have Paulina Aghedo, Joy Hermanstyle, Carla Macias, Marija, Kristo, Sagaja, Kugan. And we're going to ask them just to say a quick hello in that order. Paulina.
I think Paulina will be joining us shortly.
Okay, so we'll go over to Joy. Hi, Joy.
Hi, my name is Joy Hermanstyle. I'm an ambassador and I'm fully vaccinated. Thank you.
Thank you, Joy. Carla.
Hi, my name is Carla Macias. I work at San Romano Way Center. I work with children and also I am ambassador. Thank you.
Thank you. Marija, Kristo.
Good evening, everyone. My name is Marija, and I'm one of the ambassadors at Northwood Neighborhood Services.
Sagaja.
Hi, everyone. This is Sagaja. Nice meeting you, everyone. And yeah, I'm an ambassador for the community. Thank you.
Thank you. This evening, we also have school board trustees representing Toronto District School Board and Toronto Catholic District School Board. And they are in order. Please listen for your names. Christopher Mammoliti, Trustee Ward 4. Dan MacLean, Trustee Ward 2. Ida Preti, Trustee Ward 3. Markus D. Domenico, Trustee Ward 2. Norm Di Pascali, Trustee Ward 9. You will be hearing more from them shortly. And then we have, of course, Dr. Vinita Dubey. She is the Associate Medical Officer of Health. She's with the City of Toronto, Toronto Public Health. She's on the COVID response team. You may have been seeing her on multiple panels because she has been giving tirelessly of her time to explain to us, you know, everything from building our trust and confidence in vaccines to understanding more about vaccines. So very appropriate to have Dr. Vinita with us this evening. Just wait for us again, Dr. Vinita. And we will be joined, of course, by another of her colleagues, Nicole Welch. She will be joining us in the Q&A section. She's also a part of the response team for schools. And so you'll hear more from her later. Now we get into it. We are going to try to barrel through this because we know you have a lot of questions. And so we're going to start you off with some of the current updates that are relevant to you and from your school board trustees. Starting us off, you will hear from Ida Preti.
Hi, everyone. Thank you so much, Ms. Peart. Thank you to all the parents, guardians, and community members who have joined us this evening. We're here to serve you, and we hope that you enjoy this session. And we're navigating the next phase of this pandemic recovery together. So thank you again for joining us. I also want to take a really quick moment to thank from the bottom of our hearts, Michelle Weston, Cheryl Prescott, the entire Black Creek Community Health Center partners, Toronto Public Health, the ambassadors on the panel here this evening, my colleagues from the TCDSB, Trustee Domenico and Di Pasquale, and again, our colleagues from the TDSB, Trustee Mammoliti and Mr. MacLean. I know a lot of people are supporting us, but the panel, we didn't have enough spots to get everybody supporting us on this panel. And I just want to say thank you again to our community health partners. We've been amplifying your message for the past couple of months. And we are so grateful for the hard work and dedication that you have shown to our community. I'm going to pass it to Trustee Mammoliti now, who's going to start with the update.
Thank you very much. And again, thank you everybody for being here tonight. We appreciate it very much. Given that the TDSB and the TCDSB share a lot of the same health and safety implementations, we're going to do our best during this 10 minutes that we have not to double list. So if you don't hear something, it doesn't mean it's not being implemented. We're just trying to be as concise as we can to ensure you have as much time to ask as many questions as you can at the end of the session. So to start, we're just going to discuss very quickly TDSB and TCDSB student vaccinations. I can say confidently for both boards that we've been working continuously from the beginning of the pandemic with Toronto Public Health, our local health partners, to ensure that we're using educated public health advice to make any board decisions necessary. We cannot overstate the importance of utilizing advice from medical health professionals. And truthfully, it's been really easy with these amazing and collaborative community partners that we have with us. Additionally, you may have also seen some youth model mobile vaccine clinics in our schools and communities as of late. As more information becomes available on youth eligibility, we'll definitely be certain to share that with you and as quickly as possible. I'll now pass it over to Trustee Preti.
Thank you, Chris. Voluntary student vaccination disclosure. The Toronto Public Health has asked all boards to seek voluntary student vaccination attestations to assist with contact tracing purposes, and we have done so. In the event of a cohort dismissal related to COVID-19, students who are fully vaccinated are allowed to continue to attend school as long as they have no symptoms. Fully vaccinated staff and students will still have to pass the Toronto Public Health COVID-19 screening tool each day, confirming that they have no symptoms. And both school boards have further advocated to the Government of Ontario to update the Immunization of School Pupils Act to require the current COVID-19 vaccines for eligible students in order to attend in-person learning. Next.
Well, that would be me, Trustee Preti. Thank you. Okay. Yes. Good evening, everyone. And I want to thank the organizers of this and all of my colleagues that are joining in on this, and of course you at home that are watching us. This is an important night for information, and I'd like to make special mention of once again seeing Dr. Dubey, who's been so patient and so helpful to all of us through this a difficult time. So my section is kind of a quick one. It's TCDSB, the Catholic School Staff Vaccination Policy. Ours is slightly different than our friends across Yonge Street at TDSB. We have implemented a vaccination disclosure policy in accordance with the Government of Ontario's requirement that all publicly funded school boards do this. So the policy applies to all school board employees, trustees, frequent school visitors, and other professionals, including third-party providers, anyone basically who enters a TCDSB property. Staff that have not disclosed their vaccination status must complete regular rapid antigen testing twice weekly, with at least 3 days in between. Staff who do not comply with the TCDSB's vaccination disclosure policy or regular rapid antigen testing may be subject to disciplinary action, including being suspended with pay. And what this means is that we at TCDSB, like our friends at TDSB, we take this very seriously. We expect our staff to be either vaccinated or to be tested to ensure the safety of their fellow staff members and, of course, the safety of children and parents. Thanks very much. On to Trustee MacLean, I believe.
Thank you, my friend, and it's a pleasure to be with everybody tonight. Very looking forward to an informative night of learning. So, I've been asked to speak about the TDSB staff vaccination. As stated, the Ministry of Education requires all school board employees in Ontario to disclose their COVID-19 vaccination status. In the TDSB, this applies to more than 40,000 staff. The TDSB is currently in the process of implementing a mandatory vaccine procedure for staff, trustees, and other individuals who have direct contact with staff or students at a TDSB workplace. It is now my honor and privilege to flip it to my TCDSB trustee colleague, Trustee Norm DiPasquale.
Thank you, Trustee MacLean. It's my pleasure to talk about safety measures the TCDSBs employ to keep our schools safe. The approach to keeping our schools safe from COVID-19 includes not only using one layer, but many different layers of protection that work together to keep our schools safe and open. For starters, TCDSB has put an air purifier in every classroom. We have more than one purifier in our kindergarten classes, as well as gyms and libraries. We've also tuned our ventilation system so that every single class gets a balanced amount of air changes per day, so that there's no classes that are kind of getting like less and then some more. So we balance those. As well, active screening has worked really well to make sure that children with COVID-19 symptoms are not getting into schools and potentially passing on COVID-19. We've implemented a mandatory masking policy, and that's been in place since day one. As well, there's enhanced cleaning from our caretaking staff, and we're encouraging outdoor learning, including piloting outdoor tents last year. And we are also, through Toronto Public Health, offering take-home COVID-19 tests and rapid tests that Toronto Public Health can employ. And we've also advocated for rapid tests for all. And finally, a key safety layer in getting everyone in, getting our schools safe from COVID-19 is getting everyone in our schools vaccinated. It's key for everyone in schools and in the community to get vaccinated to keep our schools open and free from COVID-19. I'd like to pass it now over to Trustee Mammoliti to add any TDSB specific safety measures.
Thank you very much, Norm. Pretty much most is the same, not much to add. I think there's some partnerships along with Sick Kids, Michael Garrow Hospital, as well as the Women's College Hospital. We have partnerships that we're working with to support testing, of course, of both students and ensuring our schools are as safe as possible. So I believe that concludes the trustee update, and we will now pass it back to our moderator.
Thank you very much, all our trustees, for the work that you continue to do and for providing some clarity and some update for those who are joining us this evening and those who will watch this recording in the near future. As you can imagine, the backdrop for this evening is manifold. We have vaccine hesitancy, we have lots of questions, we have some unknowns, and we have a host of theories. And thrust into answering some of these and allaying some of the fears is Dr. Vinita Dubey. Dr. Vinita Dubey, as I indicated, she has a rich history with all of these panels now and is very much comfortable with giving updates and giving you the truth route. So we have with us Dr. Vinita Dubey, who will be talking to us this evening. And after her presentation, we will go into a Q&A. As I said before, we will be using the Q&A feature, and we ask that you do not crowd it as yet, because Dr. Vinita's presentation is usually very thorough, and some of your questions may be answered. So as you go through, you may want to think about, how do I succinctly put my question so that we can field your questions for you in the Q&A section. Dr. Vinita also has experience in urgent care, in emergency room as a doctor. So she has frontline knowledge as well as all her other practices being a part of the response team. We turn over now to Dr. Vinita Dubey.
Great, thank you very much. Pleasure to be here. And thank you to the organizers and to our rich panelists for being here. So let's get the presentation up and let's get started. So I do have a number of slides to go through, and then really happy to take questions from our ambassadors. I love having a presentation with ambassadors. They are doing such a great job. I call them, our hands and feet in the communities, really talking about vaccines. That is in a way that really resonates to their communities who they're speaking with. So if we could get those slides back up. And also wanted to also note that Nicole Welch is here, my buddy on these presentations, and she will also be able to help with some of the Q&A. Okay, great, thank you. Okay, next slide, please. So let's start by talking about the vaccines that we have. We're pretty much only giving the Pfizer and Moderna vaccine here in Ontario. These two vaccines are mRNA vaccines. I'm sure that's a new term that everyone has in their lingo now. What is mRNA? So, going back to my biochemistry days in university, it's messenger RNA. That's what it stands for. RNA means ribonucleic acid, even further. And really, this vaccine technology has been around for 10 years, not in vaccines, but as technology for therapeutics. And so it's not brand new. I think that's one important thing to know. The messenger RNA, what it does is it has instructions for our body. That's how it works as a vaccine, to really teach our immune system to recognize what are called spike proteins. Those are the outer proteins of the SARS-CoV-2, the coronavirus that causes COVID. So when we're vaccinated with these vaccines, our immune system can then recognize these spike proteins. So if we were infected or exposed to someone who had COVID, our body would recognize the spike proteins and automatically attack it, develop antibodies, so that you can fight the infection before you even get sick or very sick. And it's important to know that the messenger RNA does not go anywhere near our DNA. It also doesn't last very long in our body. It's actually very, very fragile. And so, days after we've had our vaccine, the messenger RNA is actually gone from our body. Next slide, please. Now, what is in the COVID-19 vaccines? I think it's really important to see that there's actually not a lot in it compared to other vaccines. It really just has these instructions, the messenger RNA, to tell our body to make antibodies. And then to protect this very fragile messenger RNA, it's wrapped in lipids, salts, sugars, and buffers. But look what's not in the vaccine. There's no eggs, there's no gelatin, there are no preservatives, there's no latex, there's no antibodies, and there's also no COVID. So you actually cannot get the COVID virus from the vaccine. Next slide, please. Now, what are the side effects that you can expect, or even for some of the children, a 12-year-old who gets vaccinated? Well, we know that there can be side effects with all vaccines: redness, itching, swelling at the site where you got your vaccine, having a headache, not feeling well, muscle aches, fever, chills. These are actually often symptoms of your body's immune system working now that you've had the vaccine. And these side effects last for 1 to 3 days, and not usually longer than that. And you could take just over-the-counter medication to treat your symptoms. Now, there is this rare side effect following the messenger RNA vaccines of myocarditis and pericarditis, which you may have heard of. What that is really inflammation in the lining of the heart or in the muscle of the heart. And so the symptoms, if you have that, would typically occur within the first 7 days after usually the second dose of the vaccine. And it's chest pain, trouble breathing, a pounding heart. Now, most people who are getting this following the vaccine, again, it's occurring very rarely, and they're responding very well to rest and to treatment. The symptoms actually improve quite quickly. I've actually diagnosed this in the emergency department with someone, and again, the symptoms were very mild, and there was no damage to the heart. Now, this is one of the reasons why we are giving the Pfizer vaccine to 12 to 24-year-olds in Ontario, because the Pfizer vaccine has less, this side effect is less common with the Pfizer vaccine compared to the Mrna vaccine. Next slide, please. Now, what about fertility? Have you heard about COVID-19 vaccines and fertility? I think everyone has, and yet there is not a single study that has shown that COVID vaccines are linked to infertility, and yet everyone has heard about it. And so I think what I really want you to know is that this has spread through misinformation on social media and is not based in science. But if you've heard it, how can I still reassure you that there's no link to infertility and that it's actually safe in pregnancy and breastfeeding? Well, first, let's look at the stats. Over 6 billion doses of these vaccines have been given worldwide. There have been no fertility concerns identified in that many people being vaccinated. There also continues to be very meticulous, ongoing research and vaccine safety monitoring to look at fertility, including some studies that have looked at, for example, sperm counts and sperm qualities or menstrual irregularities, and continue to find no link between the vaccine and these outcomes. Things like menstrual irregularities can be quite common. And so when you're vaccinating 6 billion doses of vaccine, people may have menstrual irregularities that are not necessarily from the vaccine, but may occur after vaccination. Now, I think the one thing we need to note in pregnancy, especially with this Delta variant, which is our current variant, the COVID infection can be very serious in pregnancy and for the baby. And that's why vaccines are safe. They're safe, period, and they're recommended during pregnancy and while breastfeeding. Next slide, please. Now, what if you had a COVID infection before? Do you still need to get the vaccine? And the answer is yes. We know that you can have some natural immunity from having a COVID infection, but we're not sure that the natural infection actually lasts for very long. We actually know that in most cases it doesn't. In fact, in the US right now, there's very good data showing people are getting reinfected. Now, they may have had a different variant and now they're getting reinfected with the Delta variant. So the immunity from a natural infection, we think lasts for maybe 90 days. We're not sure that it's even going to protect you against a variant, a different strain of COVID as well. And so that's why we recommend that even if you got COVID, as soon as you're cleared, you can go to a vaccine clinic, that you get vaccinated, fully vaccinated. Next slide, please. Now, what about vaccinating younger children? Now, you may have heard in the news, Pfizer, one of the companies, has provided their data to Health Canada. So Health Canada is reviewing the data on safety. How safe is the vaccine in these children? How well does it work? And what's the quality of the data and of the vaccine for this age group? Now, do children need to be vaccinated? Well, we're going to wait for the National Advisory Committee on Immunization to come up with their recommendations for children. But there's no question that this pandemic has impacted children actually very significantly. We know that children can get COVID, that's for sure. Usually they may experience mild symptoms. Some, maybe 30%, may have no symptoms at all. But some children can get very sick, including a serious side effect only associated with children, multi-system inflammatory condition that affects children, which requires hospitalization. And some can get this even if they have no underlying health conditions. Otherwise, healthy children can get severely sick as well too. Now, I think the one thing to note is while we're waiting for approvals and recommendations for the younger age groups, the best way that we can protect our young children is that every adult and 12-year-old and older who is around children to get them vaccinated. Because we still know right now that the way children are getting COVID is predominantly in their household. And so it's an adult who is unvaccinated who comes home and then gives it to their children for the most part. Next slide, please. Now, what do we know about parents' opinion on getting their children vaccinated? Well, at Toronto Public Health, we did a survey with Ipsos Reid asking this very question over the summer. And about 2/3 of parents said that they were ready to get their younger children vaccinated, but 1/3 were not. And so this just speaks to why we need to actually talk to you and talk to our parents to let them understand about the vaccine in young children and why to get them vaccinated. Next slide, please. Now let's just switch gears for a second. You may be wondering about your child's school, what happens when there's a positive case in a school. You may have already had a positive case in a school. You know, we have 1,200 schools in the city, and still, you know, a very small proportion have had outbreaks in the school since schools have started. But if someone tests positive in the school, those who are close contacts, and so a close contact is usually a child who's in the cohort, so other children in the classroom, they will be notified by public health. If they're not fully vaccinated, they will have to isolate at home for 10 days. This is one of the reasons why we're asking schools to collect vaccination status in students. So for example, in a high school, it means a vaccinated student can continue to attend school even if they were exposed to COVID, as long as they don't have symptoms. Now, public health will continue to provide guidance and advice. We do full investigations on all cases in schools, and sometimes recommend who gets tested, the whole school be tested, for example. Next slide, please. Now, just noting that there have been a lot of efforts to increase vaccinations. I have to commend our many partners, including many on the call here today, for working to get those vaccination rates up. And we've certainly seen this is a map of the city, and you see the darkest areas are the areas that have had the highest rates of vaccination in the past, at the end of September. And the young adult age group has had some lower vaccination rates. There's still some people who are outstanding to complete their series. And so all of these efforts have been really important to be able to get more people vaccinated, including in some of our hardest hit neighborhoods in the city. Next slide, please. Now, how can you get a vaccine if you're looking for one? Well, we have our standing 5 vaccination clinics in the city: Cloverdale Mall, which will be in the West End, Metro Toronto Convention Centre, Mitchell Field, Woodbine Mall, and Scarborough Town Centre. And then we also have mobile teams and pop-up clinics available as well as in pharmacies. Next slide, please. Now, just to note that mental health is health. I mean, we have all had an impact on our mental health because of COVID. And please do seek out supports if you need them, because your mental health is impaired, it needs help, because again, this is something that we have all gone through, and some of us really can reach out to get some more support. Next slide, please. Now, until we have a good control of COVID, until we have more people vaccinated, including some of our youngest folks, they make up 11% of the population. You know, as we're in the fourth wave, we certainly do not want to relax things too much, because we do not want to see COVID start spreading rapidly. We've seen what happens in other parts even of our own country when you get rid of all of your measures, and then COVID will infect. That's what it does. And so that's why we need to still wear that mask, stay home when we're sick, get tested if we're sick, keep that physical distance, and washing our hands. That's also going to help us prevent some of those other viruses that have started circulating as well this fall. Next slide, please. Now, there are a number of other vaccine information resources, and some of these are new. So we have a provincial vaccine confidence center. So this is, you just call them and they can give you information on vaccines. VaxFax is a clinic. It's actually now world-renowned, actually started at Scarborough Health Network. And this is where you can get a one-on-one consult with a physician to get your questions answered about the vaccine. Sick Kids has also started a new vaccine consult service for children, for their youth and their caregivers as well too, to answer questions about the vaccine. Next slide, please. Now, Toronto Public Health is always there. We will continue to be there for you. We have a hotline as well that's open 7 days a week, 8:30 a.m. to 8 p.m., 416-338-7600. We also have text to certain numbers, follow us on social media, and our website is updated every day as well with all of the changing information. And with that, next slide, I will turn it back to our moderator, and look forward to the Q&A session. Thank you.
Thank you, Dr. Vinita Dubey. You've heard it from her, or Associate Medical Officer of Health for the City of Toronto. She's now being joined by her colleague, Nicole Welch. She's Toronto Public Health COVID-19 School Response Team member. She's Chief Nursing Officer, and she will also be helping to address some of the questions related to schools and testing. And we still have our panelists here. So if there are specific things that our trustees can chime in on, they will. We are going to start off the questions by going to our community ambassadors. They have been thinking long and hard about this topic, just like you have, and they have some questions to start us off. We're going to go over to Sagaja.
Yes, my question is, one time I went to the mall and the mom was asking, she had the second dose, and then she had the period, like she didn't get the period for 2 or 3 months. And then her concern is she has 5-year-old son, and then if she can, how is, how safe it is to give her son. So she was worried, like she wanted to give, but she is not like anti-vaccinated or something, but she wanted to give, but because of she had that, she's concerning. So my question I wanted to read, I wrote it down. What evidence is there for the safety of vaccine in young children? Was it rushed? Doctor.
Thank you.
Okay. Yeah, good questions. Sorry, do you want me to answer that?
Yes, yes.
Yeah, okay. So good question. I think, if this piece on, whether it's safe for the reproductive system of a child, there's no question that there's no link between the vaccine and the child's growth and development. young children, youth, can sometimes have that side effect of the inflammation in the heart. It's very rare, and it's usually a mild side effect, gets better on its own. If there's treatment, it's actually Advil. That is the treatment for most people. And it's a very rare side effect. For most youth, the vaccine has no side effects at all. And so it is definitely very safe. And I think we also have to, when we think about concerns about how safe the vaccine is, we have to remember COVID. And COVID, if you get COVID, you can get very sick from it, especially if you're an older youth, 16, 17, 18, they actually can get COVID the way an adult can and can get quite sick from it. And so that's really what we have to remember when we're really concerned about the side effects of the vaccine.
Thank you, Dr. Dubey. Joy, one of our other community ambassadors, has a question.
Dr. Dubey, are there any medical conditions that can prohibit a child from being vaccinated?
You know, the short answer is no, actually. The vaccine is actually very safe in people who have medical conditions, including children. And so some of the medical conditions that we find that are challenging to get the vaccine are more so related to actually getting vaccinated. A lot of children have fear of needles. Maybe it's challenging to go to a big clinic to get the vaccine. And so Sick Kids has actually been really fantastic to be able to have special clinics for some children who need additional supports. A child, and that Sick Kids hotline is actually there for parents to actually call it. And, if a child has medical conditions, to ask them specifically for your child what their specific recommendation might be as well.
Thank you.
And Paulina. Has Paulina joined?
Not yet.
Okay, so we're going to go over to Carla.
Okay, can you hear me?
Yes, we can.
Okay, regarding the vaccine information that the parent get from media channel, sometimes it is a lot of information and often this information is unclear. And it makes parents feel unsure about the decision of giving their children the vaccine. So how do we promote the importance of the vaccine and how it works to kids and families? Also, how do we communicate with kids about the vaccine?
Yeah, it's a good question. I think actually maybe I'll get Nicole to talk about our rates of COVID in our schools right now among our 12 to 17-year-olds, because that will give you a sense for how safe the vaccines are. Nicole, do you want to fill in that stat?
For the cases that are in our schools currently? Oops, sorry, can't hear you, Vinita.
You're muted.
Our vaccine coverage rate among the 12 to 17-year-olds.
Oh, yes, great, thank you, because the other one I don't know offhand. So I'm glad I didn't have to answer that question. But for our vaccination rates, the 12 to 17-year-olds have been doing a phenomenal job. Currently, we are at, I believe it is 88% for first dose coverage and 82% for the second dose. So, this is something we want to celebrate all the time because the youth have really come out since they were eligible for the vaccine, which was, I believe, at the mid-May, around that period of time, and have really come out, and they have actually surpassed first dose for the adult population. So, let's congratulate our youth and continue to encourage them to get that vaccination rate up. We have seen in situations, and you may be aware of some of our whole school dismissal. One was in a high school. Some pockets of our city have lower coverage. That is one of the neighborhoods that have lower coverage overall for the, for all those that are eligible for vaccine. And so we do encourage everybody to continue to get vaccinated to avoid those situations where they're getting disruption in their in-person learning. We do know how important that in-person learning is, and to minimize the amount of disruption. So we continue to promote vaccination around our for our 12 to 17-year-olds, and really commend those that have come out, and encourage all those that haven't yet, please do come out, as well as the adults, the parents of our young people. We do see that population is a little lower for the childbearing age of adults, is a little lower than the rest of the adult population. So we continue to encourage all to come out and get vaccinated. Thanks.
Thank you both.
Thank you, Nicole. So Carla, just to close that loop there, to say to Carla, you can tell the parents, 4 out of 5 12 to 17-year-olds are already vaccinated in our city. And so that just shows how safe the vaccine is, that a lot of our youth are already vaccinated. And then to tell you that, even in this, the high schools, for example, that have had cases or outbreaks, most of them are unvaccinated students. And so they end up then missing school. They can spread it further. And so we are definitely seeing that the vaccines are safe and that they work in that age group.
Okay, great. Thank you.
Thank you. And one more ambassador question. We have Maria Kristo.
Good evening again, everyone. So I had a question. It's about if the person had already COVID-19 and he did the antibody tests and it shows that he has a high number of antibodies in his body, does he still need to get a vaccine, or he's safe with the high affinity of antibodies showing on his antibody test? Thank you.
Yeah, it's a good question, Maria. And I think we know that you can have high antibodies in the first few months after vaccination. But we also know that even if you have high antibodies, it doesn't necessarily mean that you'll be protected from a new variant of COVID, for example. Like if you got the Alpha variant, even if you have a high antibody, it may not protect you against the Delta variant. And we know that those antibodies from a natural infection can wane. They can go down usually after 3 months as well. And so what we do know, though, is that people who had COVID and get vaccinated, the vaccine is safe, and then they get longer term protection from the vaccine. So that's why we still recommend that you get vaccinated.
Thank you.
Okay, thank you, Dr. Dubey. And natural immunity is popping up a lot in the Q&A and in the chat. Different variants of that question have been popping up. So it's good that you were able to address that. We're going to go over to some of the chat questions. We also had questions emailed in to us prior to this evening. And so I'll go between those and the Q&A questions as well. And so one of the questions that has come in is from Maya. She wants to know, why do you need to know the status? This is a private medical matter. The vaccinated and unvaccinated are equally able to infect and spread infection. And this, the trustees may also be able to chime in here.
Well, I can tell you from a Toronto Public Health perspective, we've recommended that the schools or school boards collect this information voluntarily, so no one is requiring this information. It will help a principal to quickly decide who can come to school the next day if there's been an exposure in the school and who has to stay home. So that's the public health rationale for collecting it. If you are fully vaccinated and you have no symptoms, you do not need to self-isolate. So there is that is the real importance for knowing vaccination status.
Okay, any trustee wants to take that? No? Okay.
Sure.
Go ahead.
Yeah, so knowing which students are vaccinated, which ones aren't, can start to help us to identify patterns of schools where the vaccination is low, and then we can perhaps recommend a vaccination clinic there as well.
Okay, thank you. And so another question and variations of this question have been popping up, Dr. Dubey. What are the known and possible unknown negative short or long-term effects of the COVID-19 vaccine on children who are 12 and under, and those who are in the 5 to 12 years cohort. They want, specific data, if you have any, from any studies that, would support understanding what are the effects that are known.
Yeah, so good question. Actually, Health Canada only just received the data package from Pfizer, I think it was today or yesterday. So I don't think anyone has actually really seen what the data is on the side effects in younger children. What we do know is that for Pfizer, the vaccine that's being given to the younger children is 10 micrograms, and the one that's being given to 12 and up is 30. So it's a third of the dose. So it's a smaller dose. And so when you have a smaller dose, your side effects will be less. You can expect that probably the side effects will be very similar, that sore arm, not feeling well for a few days. The question of whether young children can get the myocarditis, pericarditis, that's something that we'll have to follow. When we talk about long-term side effects, I know this is a very common question, but what are the long-term side effects of the vaccine? And I think all we can say is we've had the vaccine for less than a year, actually. We started giving the first doses in December. And so we don't really know long-term side effects beyond a year. Right now, there doesn't seem to be any. Vaccines in general don't have long-term side effects. Once they boost your immunity, the vaccine themselves is gone from your system. And when we think about the what ifs of the vaccine, before getting too caught up in that, we have to actually balance it with the what ifs of COVID and the risks of COVID. And I think one of the things we really have to think about with COVID, especially in adults, especially in our youth, and we're learning more in young children, long COVID can be quite serious. It can have a lot of long-term side effects that can be quite challenging for people who get it because there's no good treatment. There's a lot of tiredness, a lot of brain fog, inability to exercise, and there's no good treatment for long COVID, as an example. And so when we get worried about the long-term effects of the vaccine, we also have to balance it with the long-term effects of COVID that we have a good understanding of.
Thank you, Dr. Dubey. So we still have got some lengthy questions. I'm going to try to make them as succinct as possible. This question is from a Jen. She says, hi there, thanks for this information session. A question that many parents of 11-year-olds may be wondering. My son is 11 and so will be eligible by birth year. He was born March 2010. For the adult dose of the vaccine in January. But if the child dose is approved before then, how do we decide whether to have him get the child dose or the adult dose? We know that the child dose is much lower. And so would it be sufficient protection for a big, mature 11-year-old, or would the adult dose be preferred? And Dr. Dubey, this question came in much more lengthy form also by email. So this seems to be a big challenge for those who are on the border of aging, the 11-year-olds into 12-year-olds and so on. And so the real meat of the matter seems to be with the dosage that is allowed for adults being allowed for them, and timeline, what is the wisest decision? So take it away.
Yeah. So these are all good questions. And you'll note that if you were born in 2009, say December 5th, you're 11 and eligible for the current dose of vaccine. That was a decision that was made because we didn't have an option for a pediatric vaccine. What I would say is I would follow the recommendations that come out from the National Advisory Committee on Immunization, which are likely to say that an 11-year-old should get the lower dose. And if you're worried about, is the lower dose high enough? I think the one thing we need to know, what you need to know, is that pre-adolescent age, they have a very strong immune system, very strong. And they usually develop an immune response very, if I could say robustly, very strong, and it lasts. And so those of you who know about our school program in grade 7, we give 3 vaccines. The hepatitis B vaccine that we give to 11-year-olds, or you know, at that time, 12, 13-year-olds, it is, we only need to give 2 doses. Same with the HPV vaccine. We only need to give 2 doses because at that age, their immune response is so strong that that's all they need. Compared to if you get the hepatitis HPV vaccine, say when you're 16, you need 3 doses. So I think there is something to know about the immune system in that age group, that they probably don't need a higher dose, and they probably, or if it, so if it's a lower dose, 2 doses. If it's a higher dose, maybe they don't even need the full series, like certainly not 3 doses like we're giving to some in long-term care. So I think that that's something to note. I think the other thing to note is the lower the dose, it will also perhaps help with some of the side effects, but you still, but what they've had to show in the trials is that it still works. And so that's what I'll want to see in the data as well too, before giving you firm guidelines there.
Okay, thank you. I'm scrolling through both sets of questions, so bear with me. The question now is, will vaccinations be mandated to all students, staff, teaching assistants, and anyone else who enters a school?
I will let my trustee colleagues answer that.
Dan?
Yeah, the students won't be required. The only one that can, to make students required to take the vaccine, the Immunization Act would have to change in the province of Ontario. And the only one who has the authority to do that is the Minister of Health. So until that changes, school boards won't be requiring students to come vaccinated. School boards may recommend them. The TDSB has advocated that those who are old enough to be vaccinated get vaccinated, but that's a personal choice that families will currently make, and talk to their doctors and make the best choice for them and their families.
Okay, thank you. I'm hoping that these questions are being sufficiently answered for you. A question that is popping up on both ends, Dr. Dubey, is around COVID deaths. The impression or the feeling is there are not as many COVID deaths this year, or it's comparable to last year. And so how are we, at this stage where we're, trying to get more people to be vaccinated, if the threat, I guess, is not as severe as perceived?
Yes, thank you for that question. A really excellent question. And Nicole and I are crossing our fingers because our cases in Toronto are doing well. We've had, an average of 50 to 60 cases a day, which for the, considering in September, we were higher than that. And we've had a slow decline despite schools being open. And so, so yes, COVID levels are under control right now. But what we know about COVID is it can still spread in a heartbeat, actually, when given the right circumstances. And so we can't ever drop our guard. What we do know about the cases that are occurring is that those who are hospitalized and those who are in the ICU and those who die are mostly unvaccinated. And I think that's the real answer to this question, is that the vaccinated people are still have a 97% protection rate of being hospitalized, being in ICU. And that's the importance for getting the vaccine, because you can't always predict if you will or won't get COVID. We know what that looks like. I mean, last fall, we didn't have a vaccine, and it was a lot worse. And so without the vaccine, you're just taking that many more risks, 5 to 7 times more likely to get an infection, for example. And so that's the reason to still get vaccinated.
Okay, and I think a related question is around the updating of the vaccine formulation. these questions have been coming up on both sides. One person in Q&A asked, the vaccine was created before the variants arose. So if natural antibodies are not protecting you from the variant, how will the vaccine? And then another version of the question was, in line with what's happening with school-aged children, higher versus lower dose, if there will be vaccine updates so that they will be, protected against the Delta variant, for example.
Yeah, these are all really excellent questions. And so we have in Ontario, 99% of COVID is the Delta variant. So it is the predominant variant now. It has taken over. Even though in the spring, just the spring, it wasn't that long ago, we had the Alpha variant. Now it's full on Delta variant. And what we know about the Delta variant is 2 doses continue to give us very good protection. And so to the question, well, how is that? How do we still have good protection with the original COVID and the Alpha variant and now the Delta variant with the vaccine? And the reason is because the vaccine allows you to attack the spike protein. And so the changes of the spike protein between the original COVID, the Alpha variant, and this Delta variant are not that much. And so when you see the spike protein, despite it being a Delta variant, your body will attack it and develop an immune response to get rid of the infection. And so that's why our current vaccines are still very good. And it is the Delta variant that is predominant, and the vaccines provide that good protection. Now, with a natural immunity, it's not specific to the spike protein. And I think that's probably why it may not give that same protection.
Okay. So we have a question about the probability of getting COVID. So the idea here, which is the hot topic really, vax versus unvax. Vaccinated and unvaccinated persons are able to contract the virus. So how does the vaccine work to lessen the likelihood of passing it on? And why is there this push for vaccination if you can get it either way?
Okay, so actually what I would suggest is you go to the ontario.ca/COVID website, because they have some really good daily data that shows the number of people in ICU who have COVID in Ontario, vaccinated, partially vaccinated, and unvaccinated. And that's being updated on a daily basis. And it really shows you that it's really predominantly unvaccinated who are getting the severe illness. Now, if you are vaccinated, yes, you can still get COVID. You are less likely to get COVID. If you get COVID, it's more likely to be a milder illness. I know this even in the investigations that I've had of people who are fully vaccinated and get COVID. And because it's, we also have a better sense that if you're vaccinated and you get COVID, you have lower chance of spreading it and are maybe less infectious for less time as well too. And so, so that is all good news as well too. But it is also the reason why, even if you're vaccinated, if you have a symptom, get tested. If you've been exposed to someone who has COVID, while you don't have to isolate, we still recommend that you get 2 tests, one right away and one after day 7 from your exposure, because we want to be able to detect infections that may be occurring in vaccinated individuals, even though it is less likely.
Okay. So Dr. Dubey, there's a question here saying, if public health says Pfizer and Moderna mRNA are almost identical, why has the FDA put a hold on the Moderna for 12 and under?
Actually, the FDA has put a hold, I believe, on Moderna for 12 to 18-year-olds. Moderna, I think, is approved for 18 plus. The reason is because, just like we've seen in Ontario, is that Moderna is actually a higher dose. So they both use the messenger RNA technology. The dosing is slightly different, and the Mrna vaccine has been associated with slightly higher myocarditis and pericarditis. And it's one of the reasons why in Ontario, we are only giving Pfizer vaccine to that 12 to 24-year-old age group.
Okay. Working through all the questions here. Let's do a time check. Okay, so we're at 8:01. So one of the questions in our Q&A, many consider this to be a bad flu, and that's why some countries are removing restrictions. Why has no government agency advocated for the usual keep healthy message, eat well, get proper nutrition, get enough rest, and support your immune system in general? We've survived this so long. Why not strengthen and support our immune system to defend all bacteria and viruses?
Actually, that's a really good question. And actually, Alberta is one example of a place that said, you know, COVID is going to be here. And so let's just open up our society and learn to live with COVID. And we can see what's happened in Alberta. In fact, it's extremely tragic what has happened there. COVID will spread like wildfire. And the big concern is really on our healthcare system. And it's taken me a long time to understand, what does that mean? Like as a mom, as a parent, as a person, what does it mean that our healthcare system is burdened? It means that if my family member has a heart attack and they go to the emergency department, there is a bed to be able to treat my family member with a heart attack. And they're not full. They're not going to say, sorry, go somewhere else. Or if they need an ICU bed, there's an ICU bed available, and they don't have to find ICU care for a non-COVID illness like a heart attack. That's what having healthcare capacity means. And that's why we need to have a better check on COVID right now, because if we let COVID go right now, it will overwhelm the healthcare system. We've seen that in many states in the US. We've seen that in many provinces in Canada as well too. And so as we get more and more people vaccinated, we will end the pandemic. I mean, I promise you, the pandemic will end. And COVID will be like the flu, like other viruses that occur on a seasonal basis. And it's still important that we do all of those important things to look after our health, like exercise, like build our immune system, get enough sleep, for example. But we have to do a little bit more in this pandemic because of those other reasons as well.
And a question here, why do doctors keep comparing other vaccines to the mRNA vaccine when they're totally different, thus creating some confusion?
Well, let's not do the comparison then. I mean, we certainly didn't do the comparison in the presentation. I think there's no question that the messenger RNA vaccines are different, and actually a real scientific breakthrough. I mean, we have had, look at our flu vaccines, which can sometimes not protect our elderly in the way that they need protection. People who have weakened immune systems don't get the best protection from some vaccines. And yet this messenger RNA vaccine has been able to protect even those who have a weakened immune system. So it is absolutely a different type of vaccine. But what is common is that the concept of a vaccine is to take it before you get infected. It's all about prevention. And that's really the goal of a comparison, to really understand that.
Okay, and this question, maybe our school board trustees can assist. Why are teachers being required to be immunized if there are parents who choose not to be vaccinated, sending their kids to school?
Yeah, so what we need is everybody who can get vaccinated to get vaccinated. The more people we have vaccinated, the more protected our school communities are. And those that are in our school communities every day, it's incredibly essential for them to get vaccinated to keep our schools safe and open.
I just want to, sorry, Dana, I just want to point out that the Toronto Public School Board and the Toronto Catholic District School Board have two slightly different policies when it comes to vaccinations. Toronto Catholic District School Board at this moment in time, I'm not sure if Superintendent Superintendent Campbell wants to explain. It's either a 2 tests per week or the vaccine at this point. And I believe the Toronto Public School Board, I'm going to let one of the trustees explain what their policy is right now.
Dan? Who's got it?
Sean?
I'll do the TDSB one if you like. Effective November 1st, all trustees and staff and anyone working in the building will be required to be fully vaccinated. As we said earlier, that we can't require the students to be fully vaccinated, but we're doing everything we can to make sure everyone that can be in the building, that everyone that we can require to be vaccinated is. So our policy is in effect. Our staff has been made aware. They've had a long time to get themselves fully vaccinated, and our policy is similar to what's happening in the city, in federal governments. It's happening in a lot of different places throughout the country, and what's currently going on in our board will change November 1st, and there be a reasonable expectation that all adults will be fully vaccinated.
And I'm happy to just clarify what Trustee Preti said. Hi, I'm Shauna Campbell, Executive Superintendent with Toronto Catholic. So our, as Trustee Preti indicated, our policy is slightly different from TDSB. All boards in Ontario were legislated. We had to implement a vaccination policy. Ours currently mandates that all staff must attest to their vaccination status. Those who attest that they are fully vaccinated we have that information. Those who do not choose to attest are presumed to be in the unknown or unvaccinated status, and they are required to complete 2 rapid antigen tests per week, Sunday and Wednesday. They need to upload the proof of those tests, and currently, as of last Friday, any non-compliant staff members in all employee groups have been suspended without pay and sent home, unfortunately, until they are willing to comply with our policies, expecting that they are safely testing or that they are fully vaccinated. That's our current policy.
Okay, thanks for clarifying both, or great batch of trustees that are here on the panel. I'm going to go back over to Dr. Vinita Dubey here. Interesting question, Dr. Dubey. My brother had a TIA after his shot. That's the transient ischemic attack. Am I more likely to have the same reaction due to genetics? I also witnessed a change in personality in my elderly grandmother after her shots. Her behavior was worse after the second shot. Again, is there something genetically that I should be worried about?
Okay, thanks for the question. I do want to encourage you, if you have specific questions about your health, I mean, I would recommend that you have a consult with VaxFax. Like, it's really challenging for me to give you health information specific to you without knowing all of those details. So that's what I would recommend, that you make an appointment to speak to one of the doctors at VaxFax.
Okay, and one of our lengthier questions, mRNA is quickly broken down by enzymes in the cystosol of the cell. How can we be sure that there is no biochemical pathway that can convert mRNA into DNA? And we know this is a common conversation, Dr. Dubey. Retroviruses do this all the time via reverse transcriptase. Can you speak to the research that shows line 1 retrotransposons and integrating mRNA into a human genome by endogenous reverse transcription? How can we be sure the same will not happen with the mRNA vaccine?
Okay, that's a very, very high tech question. A lot of biochemistry in that question. You know what, I don't know the specifics of the biochemistry. There's a lot to know about this. I think the real question that I would ask you is, what about COVID? I mean, COVID can impact your cells, can make you very sick. And I think when we worry about some of these very specific concerns about the vaccine, we always have to balance that with COVID. And we know that COVID itself can be very harmful to ourselves, to our organs, to all of our organs actually in our body. And that's really what we're trying to prevent by getting the vaccine. And so, this is a pandemic, and we've seen that COVID has been actually devastating for all of us in different ways.
Okay. This question, I actually saw this person repeat the question in our Q&A and also emailed it. So I'm going to try to get it in. As an example, the Pfizer vaccine states on its product monograph, available on the vaccine covid-vaccine.canada.ca info website, that it is unknown whether Comirnaty has an impact on fertility. It is unknown whether Comirnaty has an impact on fertility. So this person is very curious about that statement. And the vaccine is still being used on younger populations without knowing if this will have an impact on their fertility. Any statement?
Yes, yeah, absolutely. So I think when you look at the product monograph, what's in the product monograph is based on what was determined in the clinical trials, usually the phase 3 clinical trial of the vaccine. Sometimes the product monographs continue to be updated, but that's usually what is written in there. So there's a lot of things that they don't know about in that clinical trial. But we actually have what we call a phase 4 clinical trial. That is when we give the vaccine in real life to populations. And in this case, we've given COVID vaccines to 6 billion doses of COVID vaccine around the world. And that's how we can be more confident that the COVID vaccines do not have links to infertility. I think it's also important to know that there have been no studies linking COVID vaccines and infertility. I mean, if you look back to how this started, it was based on misinformation that was spread on this topic.
And a shorter question, Dr. Dubey, is about the possible effects for adults. We've been focusing a lot on the children, but the parents are in the room as well, and they're curious about the effects on themselves.
For the vaccine, yeah. So, I mean, the vaccine is proving to be very safe in adults as well. We know that the older you are, the more at risk you are for severe disease from COVID. And in fact, being 40, even 50, actually puts you at higher risk for severe illness from COVID. And that's not even that old. Even healthy people, healthy adults can get very sick from COVID. So the benefits of the vaccination compared to the risks of COVID certainly weigh out in the benefits of the vaccine, given our current situation where COVID continues to spread in our city.
Okay, and we have allotted 5 more minutes. So I'm going to try to get in as many questions as possible here. In the UK, the CMO has decided to offer only 1 dose of the COVID vaccine for children 12 to 15 years old, as they have concerns regarding the effect of the 2-dose program, and also find 2 doses are not required for children. Is Canada aware of these limitations that happen in other Western countries of the world, and is the general public informed of these limitations?
Okay, yes. So another good question. I think it's important to know that each country makes their own decisions. A lot of it can be also based on vaccine supply. And we've actually seen in Canada, we had to make very tough choices based on limited vaccine supply in the spring. One of the choices that we made was give everyone 1 dose of vaccine and delay that 2nd dose. That turned out to be a very good decision. We know that delaying that 2nd dose actually resulted in that 2nd dose having a stronger immune response. And so that's why in Canada, we're not seeing that same type of waning of immunity of breakthrough infections compared to places like Israel or even the US, where they gave the 2 doses in that short interval between 3 to 4 weeks apart. So yes, different countries have to make different decisions, often based on the logistics for those countries as well too. And we do certainly follow the decisions that other countries make regarding their vaccination policy, but ultimately have to make decisions for the current context in Canada.
Okay. Question has been in the Q&A. Currently in Ontario, a fully vaccinated individual that is infected by COVID but has a mild infection, they may not even identify as such, can go to a bar, a sporting event, indoor restaurant, or convention and effectively transmit COVID to others while having the privilege of being unrestricted compared to an unvaccinated person. Is this not defeating the supposed purpose of vaccine passports, of controlling spread? An unvaccinated person that is not sick is not allowed into any of those spaces, even though she offers no threat to the wider community. Is the general population aware of this?
Okay, yes. So I think what we need to first recognize is the unvaccinated person has a higher risk of getting COVID. And so that's the first stance, 5 to 7 times higher risk of getting COVID in general. If you're vaccinated, so you're less likely to get COVID, but you could still get COVID. And that's why even if you're exposed, we recommend if you're vaccinated that you get tested. Again, 2 tests in a 10-day period. And that is to detect a COVID infection even in fully vaccinated individuals. But also that is why even if you're fully vaccinated and you go to a sporting event or to the cinema or wherever it is, you are required to still wear a mask, except for when you're eating. And that is, again, why those measures are still in place in these places, to prevent any potential spread that may be occurring even among vaccinated individuals. Now, this is one of the reasons why we need to go slow in reopening, because we need to be able to see the effects of having large people together, say watching a sporting event, who are vaccinated, and to ensure that we're not seeing a lot of spread of infection.
Okay, and we're now in flu shot season, Dr. Dubey, and somebody is asking, if I get the flu shot, do I still need to get the COVID vaccine?
Yes, the answer is yes. We recommend that you are double vaccinated. And this is to prevent what some people have called a twindemic, COVID peak and a flu peak. And again, what we're really trying to do is to prevent as much infection so that we don't put a burden on our healthcare system, so that we're not running to the emergency department and blocking our hospital beds. And so if you haven't been vaccinated for COVID, you can actually get your flu shot and your COVID shot at the same time. That is safe and now recommended, and you'll be able to do that even at many clinics that will have both vaccines available. But definitely we are recommending that everyone get the flu shot. The one thing that's different about the flu compared to COVID is flu can be very serious in young children. So children who are under 5 years of age, they can get quite sick from influenza more commonly compared to even COVID. And so that's another point, is that children, young children in particular, should get the flu shot.
Okay, and kind of a procedural thing. If I am without an OHIP card, how do I get a vaccine passport?
You can actually get the vaccine without an OHIP card. So if you come to a City of Toronto clinic, you can come, just walk in, and you do not need an OHIP card to get the vaccine. What they will do is they can often give you an identifier so that you can use that to get your vaccination receipt, even without an OHIP card.
Okay, and if I had COVID after my first shot, should I still get a second dose? And additionally, if I have a high number of COVID antibodies, do I still need the vaccine?
So the answer really is yes, you're recommended to be fully protected. Again, That note on antibodies, I think it's important to know that even among scientists, there's no threshold to say if your antibody level is here, you have confirmed protection for life or even for 2 weeks or 3 weeks. If from a science perspective, we call these correlates of protection, and it's not clear because you have B cell and T cell immune responses that are required to clear a COVID infection. So don't just rely on that very expensive blood test for antibodies to assume that you are immune.
Okay. Thank you, Dr. Vinita Dubey. I think we're at time. We're a little bit over on our Q&A, and we obviously did not get to answer all the questions that were here, emailed, and also in the Q&A section. But we do hope that it was useful to you and that those questions that we got to were valuable for your information. We're also going to provide you some more resources at this time. So we're going to go over to those slides. So here you'll see information about vaccines, Provincial Vaccine Confidence Center, FaxVax, which Dr. Dubey mentioned multiple times. Sick Kids has a vaccine consult service, and Kids Health First information about COVID-19 vaccines for Ontario youth. So there are a number of resources, and obviously you'll have more questions. I find as you ask questions, you have more questions. So, and Dr. Dubey has been making the rounds to try to keep you, informed throughout this whole process as being a part of the COVID response team. And so we encourage you to follow up. We encourage you to look out for more information coming out from all our partners this evening. Here you have Mobile Clinic Locator. You have a Pharmacy Clinic Locator. You have Black Creek Humber Cluster Vaccine and Town Hall Calendar, because there will be more town halls done with this cluster. And of course, phone numbers. If you don't remember anything else, write down the Toronto Public Health Hotline, which is 416-338-7600, or you can also contact Black Creek Community Health Center's COVID vaccine info line, 647-883-0316. And here we have the existing clinics in the city of Toronto: Woodbine Mall, Cloverdale Mall, Metro Toronto Convention Center, Scarborough Town Center, and Mitchell Field Arena. And local vaccine clinics: Humber River Hospital, Black Creek Community Health Center, which has 3 locations here, 3 different time span. So you can go to the York Gate Mall, or you can go to the Sheridan Mall, or you can go to the vaccine clinic for sickle cell community members. And then of course, Rexdale Community Hub. York University's Aviva Center is also doing vaccine clinics, and the Toronto Public Libraries and Community Centers are also engaged in this process. Black Creek Branch, which is at Sheridan Mall, Amesbury Park Library, which is at Lawrence Avenue West, Pelmo Park Community Center, which is at Pellet Avenue. And of course, you can go to the City of Toronto's page to find the test locator. And here are also the numbers again for you to reach out and get some more information. You can also call and visit Black Creek's website for more information, or you can visit these websites that are listed here: Humber River Hospital, Finch site, and Church site, and Branson site also offer testing clinics and assessments. So a little bit about school take-home kits. They're available for symptomatic students and staff and asymptomatic individuals who have been identified as close contacts of a positive COVID-19 case. Kits are supplied to schools by Sick Kids Hospital and Michael Garron Hospital. These testing kits are polymerase chain reaction, that is PCR tests, and they require processing at a lab. Results are generally available between 48 and 72 hours. Contact your specific school if you have further questions. And a reminder that the recording of this evening's panel and webinar will be available on Black Creek Community Health Center's YouTube channel. Transcript and frequently asked questions will also be shared with schools and posted online at www.bccchc.com. We want to thank everybody who has taken a chance to participate in this evening's vaccine information session. We tried our best to get to all the questions and more, and we want to thank all our panelists who have taken the time out to be here to give us the updates from the trustees, and also, of course, Dr. Vinita Dubey, who gave us a presentation as well as a marathon run at answering all the questions that were that we could get in during this time. Of course, look out for more information sessions and look out for more town hall style as well as webinar style coming from these partners: City of Toronto Public Health, Black Creek, Toronto District School Board, Toronto Catholic District School Board, and the Black Creek Humber Summit Cluster and Vaccine Engagement Team. We thank everybody for taking the time to be with us this evening, and we wish you a safe evening. Remember to continue to do your precautions. COVID is real and continues to have impact on our society. Thank you all.